I'm the founder and CEO of iPlena, and maybe a bit more to me, I'm a physiotherapist and osteopath, so I have a medical background in this field, and all this was triggered by myself, let's call it like this, because I have a scoliosis when I was 9 years old that was so strong that my parents brought me to a scoliosis boot camp, and this was not the nicest way to treat me with 9 years. And I came back with a better scoliosis, but with a traumatic experience. And this was for me that point in my in my medical experience where I say I have to make it later different. So it all started. Okay, thank you. So it all started. I asked myself, or I asked why we treat posture just two-dimensional. So we think about posture just from the side. We are not thinking about bad posture if we think about unaligned shoulders or unaligned hips, or maybe one foot is more outwards rotated than the other foot. So this is much more a problem than just a tech snack, for example. But anyhow, the question that was asked by one director of a school in Myanmar, where we have also a project, was really interesting. So, who actually controls your posture? This is a question what we should question ourselves, because many of us are treating the posture by just training muscles. So, for example, we're making some back exercises, or we make some static exercise and so on. But actually, our posture is controlled by our central nervous system. So this is the central nervous system is influenced by every movement we make. So it's impossible not to work with it. But we can really specifically work with it. And this is also where iPlena starts. So we are based on a proprioceptive neuromuscular facilitation, so short PNF. This is a technique out of neurorehabilitation. And here the main point is to stimulate the muscle memory, the joint memory, in combination with the neuromuscular connection, so with the connection to the muscles and the neurons, and facilitate it. So this is PNF. So we facilitate good posture, we facilitate good posture, not just movement, also patterns. So we can stand different, we can move different, we can sit different. And all this just by stimulating the central nervous system. So actually, the problem in the whole cycle of the normal patient journey is that we are master in acute medicine. So we know, as in the roundtable discussion before we discuss this topic, that a patient comes with pain. He has pain, he wants to solve pain. That's right. So when he solves this pain, what's then? What's the motivation of the patient to continue? And how high is the commitment to do so? So here it all starts. So we have to create an understanding of the problem. So understanding the problem is the first way to solve the problem holistically. And this is also where iPlena connects. So where the normal patient drop off, iPlena came in. So we go to this, so we solve especially problems like this also, not just problems from that are asymmetric. Sorry, the slides was other way around, but no worries. So yeah, tech snack. Everybody of us know it, but not everybody of us know it that we can see differences on MRI or X-ray pictures. And how can it be possible? So our body is adapting to modern lifestyle, and this is something that is alarming. We are in an epidemic of bad posture, And all this starts because of we're sitting a lot, we're moving less, and we are not knowing what to do to improve this. Because if we go to orthopedic doctor, we say, yeah, watch less to your phone, stand more straight, go swimming. So all this stuff, everybody of us heard it once, but who is committed to do so all his life? And here we need fast, accessible, and easy solutions when patients understand what to treat, how to treat, and how they can do so. So what iPlena is doing, one of our modules is we create an AR spine, and AR spine visualization is one of most powerful tools for patients to understand their spine. It's like a gamification of posture problems. And imagine when you see your spine just created with your phone, you don't need something else. Would you invest 2 or 3 minutes a day to treat this problem? I think this is something you can convince a patient. And we see it in our clinics. We have 3 of them in Baden-Baden, south of Germany, that it works like this. We need a hybrid way for the future of health. It's not a pure digital way. Like we see in our clinics is a combination, because an AR spine not explained by a medical professional is just a gaming tool, like something cool you look at. But if somebody who really has medical background and knowledge how to explain this to a patient, then the patient get committed. A patient start to understand what actually is my problem, what actually I can do against my problem, and what actually how long I should do something, because this is the question everybody of my patients ask me. And then I say, okay, how often you have to shower? How often you have to brush your teeth? It's normal that you have to do some routine, but imagine you have to brush your teeth half an hour a day. Nobody would do so. And the teeth would look incredible. And this is the same thing as about posture, because many people are solving posture problems with half an hour training, even 20 minutes. It's too much. It's nothing you can do all your life long. So we need an easier way and more accessible way to do so. The approach of us is establish the root cause, create the patient a fully understanding of their posture. So we not just checking the posture from the side and from the front, we also check the posture in sitting position, because it changed. And what does it say to us? If the posture in sitting position change, we can interpret and we can adapt the training. For example, if we stand and the head is not aligned or the shoulders are not aligned, and then we sit down and the shoulders are, and the patient have neck problems, it doesn't help the patient if you just massage or do something for his neck. You have to solve instability in the hips. This is just an example. But here also, there are many, many things that can be seen just by comparing standing and sitting posture. And then we can provide the patient with a plan he can follow, he can understand, and he see the way it goes. Because if the patient just get a problem, but nothing to solve, or not understanding how long and how much and what should I do, then you lose the patient. And this is something that's really, really important to be aware of, not to get too complicated. Because most of the posture reports and most of the postural assessments are really, really heavy and complicated. Patients are giving up. It's like you have a to-do list of 200 to-dos. You would do it? No, you would put it in the trash and say, okay, I'm not productive. And here, the same here. So we should do posture more accessible, more easy and understandable. So the time to value should be much more shorter than it is right now. And also the tracking of your postural progress, the tracking of the results. This is one big point. And here is iPlena also solving the point that we're not working with big data. We have much data points. Yeah, we have a lot of patients already scanned, but is it useful to put all of them in one algorithm? No. It makes just sense to make the algorithm more personalized to you. Reinforced learning is much more effective for postural treatment than just big data. This is one big important point that has to be understood, because we work, for example, with Kenya, with US, with Germany. So what happens if we put all these data points together and then we assess the posture of a European? It doesn't make any sense, because the lordosis in Africa is much more than in the US or in Russia or in Asia. It's the different postures all over the world. So it makes more sense to keep the algorithm, the first assessment, simple, and then get more and more personalized by tracking your posture, tracking the trainings you make, tracking the exercises, because we do an asymmetric training to make the body more symmetric. So this is something that is adapted to your posture asymmetries. And what we see here is what happens if you do so. So if we look just at the right picture, so from the left picture, sorry. Many of us would say this is normal. Many of us would say, okay, I see a lot of girls, a lot of boys that run like this. Because we put 4 times more load on one leg, because we're jumping here, than our body weight. So if we are weight, for example, 60 kilogram, then we have to keep there 240 kilogram on one leg. And if the hip is not stable, and it's not just the hip, it's the whole muscle chain. If it's not stable, this happens. And then a really strong ligament, for example, in the knee or somewhere else in the body, can get injured really, really fast. And what iPlena do is, we're working on this, and not just on the posture from the side. iPlena's first customers was all sportsmen. All this method was developed to make sportsmen more stable, more in less time. Like, we work with them, we have like 15, 20 minutes on the court, for example, with tennis players or football players, and it works. So we have before and after in really, really less time. And it's all because we train the central nervous system, and not just the posture from the side with, for example, putting the arms up or standing on one leg or all this stuff. You can Google or YouTube it. So iPlena's exercises are different. And the market, or what we can save here, is huge. Because if we look just at the US market, for example, we spend, the whole overall healthcare spend is $10,000 per year, per person. And 2.7 just for physiotherapy. And we have digital physiotherapy out there, yeah, but is the cost going down or not? This is something we have to take a look at, because digital physiotherapy just automates a system that doesn't work also offline. So why it should work now online? Yeah, the consultations are less costly, but you need often more of them. And what is also a point, when you just treat the patients as you treat them before, just in an online way, you have less commitment, because you have to convince the patient to do something. And how you want to convince the patient to do something if you're just sitting like one-to-one in a camera? How? You cannot assess his posture. You cannot say to the patient what he should do just by looking in his face and sitting in front of you. It's not possible. Even if you look at some X-ray pictures, you have to assess overall posture, and from the overall posture go into the detail and into the treatment. And then you can save money. This is the way. And here we have invasive treatment, we have medical image, everything, prescription. Like, there is a lot of treatments that we can get, we can do. But what is really I'm not saying that doesn't work. It works, but what of it is really long term? This is the question. What of this treatment's really long term? For example, if I make an operation or I take a painkiller, for example, I'm not saying painkillers are bad. We need painkillers, not question. But does it solve the problem? This is the question. And if I make an operation, for example, if I have an injured hip, solve this my problem, or solve is just a structure that is damaged, but the problem that caused my hip is not solved? And that is something we have to look at. This is something we can save a lot of money, a lot of resources, because we act holistically. We look at the posture as one, and not you have knee pain, we make exercise for the knee. You have shoulder pain, we make exercise for the shoulder. You have shoulder pain, yeah, but maybe you need to stabilize the whole muscle functional chain to make them better. This is the way we think. And we give the patient also the possibility to be more engaged by himself. So the patients take responsibility, a part of it. So the patient know, okay, I can just put my phone somewhere at home and just scan my posture, get the result, see if it's working, and get maybe new exercises. Maybe the shoulder position change again, maybe the foot position, maybe sitting position. So everything can change. And when it changes, then the AI algorithm is adapting. The reinforced learning is getting more and more personalized to your posture and giving you more and more recommendations that you need for your body to get better posture, less asymmetries, and a better lifestyle, because the life quality gets much more better if you're not solving the pain. This is something we need to understand. If we try to solve pain, and this is our main goal, we will never get rid of pain. This is one big rule, because pain is just a signal. Pain is not the problem. And if we think that pain is the problem and we try to solve pain, we lose. And we have to question pain, we have to understand pain, and we have to work holistically overall on the posture. What we did, and these are real pictures, we have much more of them, but what I want to show you here is that real scoliosis is really, really rare. I mean, a scoliosis that you cannot solve with exercises or cannot improve it. I'm not saying that we solve scoliosis, but I'm saying we can improve scoliosis. And we show it on many, many patients. And what we see here is this patient, how long do you think he trained? This is a result of 4 weeks. And we have even results after the first session. Yeah, they are not lasting. That's true. They're like lasting for 20 minutes. But his results last. Why? Because he did it for 4 weeks every day. So he get a new automatization, a new program based on his training. So his body, his central nervous system reprograms and get a new program that makes the posture look like this. The foot load change, and also the whole body load gets more aligned. And this is the normal or overall process of the whole program, because you just scan your posture, you get a visualization, you get results, you get your problems, you get a specialized training that you don't find on YouTube or on any Google page, and then you can even connect to physicians and get a personalized consultation. What we do is we make it offline and online. So our main customers for now are physicians and physiotherapists, because they use it to create posture reports, to create posture analysis assessments in 3 minutes, and they can charge them normally. And this is something the physicians get motivated, because they spend less time for the same procedure, And the patients get motivated because they have a fast time to value. And when the time to value fits the investment, then it works. And this is the mission of iPlena, and let's make the world healthier together. Thank you.